Welcome back to TV5 News at 9. Joining us this morning is Carmel Roberts, the CEO and practice administrator at Valley OBGYN. We are delighted to have you back. Thank you so much for being here. How are you this morning, Carmel?
Doing very well, Colette. Thank you for having me back.
Of course. We're excited that you're here. Well, today, everything you need to know about local surgical specialists in women's health. That's where Valley OBGYN comes in. Tell us a little bit about your practice and what surgeries that your doctors specialize in.
Of course. Valley is a locally owned, physician-owned, private women's healthcare practice. We've been caring for women in Saginaw and the surrounding areas for over 50 years. So we certainly consider ourselves experts in women's care. All of our board-certified physicians and advanced practitioners right down to the staff. We have a lot of longevity and dedication specifically to women's health. So we are very familiar with all of the things that women face through all different phases of their life.
That's awesome. So you have a lot of specialties. Tell us about some of the specialties that your doctors take care of there.
You know, really when it comes to it's OBGYN, so there's definitely the OB side of things, you know, during childbearing years, and we get to be there for the fun part of caring for our patients through their pregnancy, but the other half of that, the gyn or the gynecological, is really equally as important. It's every other stage of life, pretty much. The types of things that we see that can sometimes need surgical intervention really boil down to 4 categories. At some point in a woman's life, she may experience issues. She may have menstrual problems, either heavy, painful periods, or premenopausal or postmenopausal bleeding and irregular periods at that transition stage of life. So we certainly want to take a look and evaluate patients for that and determine whether or not surgery or a less invasive procedure may be needed. Pelvic pain is another common problem that a fair number of women experience. Usually that's a little harder to diagnose. It takes a little longer surveillance to be able to accurately evaluate it, but depending on what the issue is, it can be another need for surgical intervention. Urinary incontinence is something that we do tend to see a lot of, sometimes older in life, but not always. Pelvic pain and urinary incontinence, those can sometimes be more embarrassing conversations that patients are initially reluctant to talk about. If you have painful intercourse or just the incontinence that's embarrassing usually. So we just feel like it's important to be able to have those conversations with women and to let them know that there are things that can be done. And finally, the 4th category, sometimes if you've had a surgery like a hysterectomy or other types of procedures, or you have a weakened pelvic floor from birth, childbirth, that type of thing, you can get what's called pelvic organ prolapse, which does involve a fairly advanced surgery to go in and surgically support or lift up the pelvic floor, and that's something that our physicians are certified and experienced at doing. So we really run the range for any of those types of issues. From least invasive, which can be in-office surgical procedures, all the way up to complex robotic surgeries like the one I just mentioned for the pelvic organ prolapse, hysterectomies, things like that.
Well, you really are the place to go for women's health surgical needs, that's for sure. Thank you for that information, Carmel.
Yes.
You know, I have a young daughter, a teen, and many moms like myself want to know, when is it recommended that women, teens, should begin having their annual women's exam?
I think for teens,
Yeah.
that can be a parental choice.
Okay.
I think it's a good idea. It's obviously a preference. We do see teens. There's a lot that goes on with teenagers, so making sure you get them used to coming in for
Right.
routine screening is always a good idea. That way we're developing that relationship early. As I mentioned before, there are a lot of things just with reproductive health in general that can be embarrassing, or people might not be as comfortable talking about. And so the younger, I think, girls or teenagers, young women have access to a safe, trusted source of good, reliable information that's going to treat them as a whole person and help them develop those healthy habits. That's really what we're here for. You're not going to tell us anything that's going to shock us that we haven't heard before, and truly that's what we're here for. So I think that, earlier, in my personal preference or opinion, the earlier the better. As a teen starts menstruating and, sort of beginning those stages of life.
I love that, Carmel, because that gives them a way to really trust their healthcare provider and to just start developing that relationship, which is so important for girls and women. So tell us, why are these exams, these routine exams for women, so important?
I think routine exams, they do two things. They're really, they're screening by nature. So we are making sure they're exactly routine. So we want to make sure that we have regular checkpoints in a woman's life and her health to screen and to, have that baseline reference on a number of different health factors.
Yes.
And to make sure that nothing is developing in a way that we wouldn't expect. But I think the second part of it is just building that relationship. Oftentimes, our annual exams, we will find out that there are one of these other issues going on, or like menstrual problems, or pelvic pain, or urinary incontinence, or painful sex, or just questions about other things. And so just establishing that relationship with our patients on a regular basis, the annual exam really gives us that opportunity to, number one, check in on all of those women's health vitals and screening to make sure there aren't any gaps. But two, to make sure that we are also just checking in overall on their health and making sure that there's nothing else going on that we need to be helping them with.
Yeah, Carmel, I have to ask you this because we are in the middle of a pandemic still. So a lot of people are hesitant about going to the doctor during the pandemic. What would you say to those patients about how important it still is to get to your doctor?
I would say that in today's day and age, I would not, even in a pandemic, taking all precautions. We pre-screen patients for any symptoms before they come in. We offer telehealth. I mean, every mechanism that we have to keep our patients and our staff safe, we've definitely taken. But more importantly, your health is just too important to put on the back burner or to wait. We don't want to see gaps in care, or, God forbid, miss a breast lump, or have women out there suffering with painful periods or heavy periods, or things that we really need to evaluate to make sure that there's nothing, more concerning going on.
Sure, and you are accepting new patients, is that right?
Absolutely.
Okay.
At all three of our locations.
We'd love to hear that.
Saginaw, and Freeland.
Frankenmuth, Saginaw, and Freeland. Thank you so much for calling in today and bringing us this valuable information. We appreciate it. Thank you.
My pleasure. Thank you, Colette.
Of course, you're welcome. And if you'd like any more information, just head on over to the hot link section. That's at WNEM.com.